So,
All right, Ben. Verify the medical prescription for the insertion of the nasogastric tube. Provide privacy as needed.
okay, what does provide privacy as needed mean to you? Pull the curtain shut. Okay, great. The prescription, we will either have one or not have one of just insert NG tube. That's all it means, right? Okay, keep going.
All right. Introduce yourself to the client, verify client identification, and check for allergies.
Okay. Hi, my name is Professor McNichol. I'm going to insert an NG tube today for you because it was ordered by your doctor. Can you confirm, while looking at the wrist, right, your name and date of birth for me? This is Ramona Gomez. Date of birth is 8/22/1945. Medical record number is 215475P. And patient has no known allergies. Is that right? Do you have any allergies at all? No? Great.
All right. Perform hand hygiene.
Okay, no problem. Not using this because it stinks.
Provide client education. Develop signals to communicate during the procedure.
Okay, so this part is vital, right? This is the thing that's a little open to interpretation because it doesn't tell you exactly what to say on your checklist. But as someone who's watching you do it, the things that I want to hear are, we're going to put in an NG tube, okay? We can just all assume that the reason that the person's getting an NG tube in is because they've got a small bowel obstruction, so nothing's going down, and your stomach doesn't know that, so it keeps producing acid, right? It's filling up your stomach with acid, and that's getting pretty uncomfortable for you, right? These people normally will be vomiting or having a lot of reflux or burping, and it's really uncomfortable, okay? So we're gonna put the NG tube in to go ahead and suck out some of that excess fluid until we can clear your small bowel of this obstruction, okay? So let's just all say that's our reason why we're putting it in, okay? So the client is entitled to know why it's happening and how it's happening and exactly what it means, right? Okay, and let's not lie to them either. Is this gonna hurt? Yeah, this will probably be pretty uncomfortable, okay? I'm going to try to make it as easy as possible and move as quickly as possible, but it will not be very pleasant, okay? The other thing is that sometimes it's hard to talk because the tube can sometimes brush up against your vocal cords, and that feels weird. So instead of trying to verbally communicate with me when you're in distress, I want you to raise your hand at me, and I'll stop whatever I'm doing and we'll check in, okay? I'll either pull the tube out completely and start over, or perhaps we'll just pause, let you catch your breath, and keep going, okay? So that's what I want as far as education. Does that make sense to everybody? So you need to tell them why it's happening, what's gonna happen, okay? And then any instructions that you need them to follow during the procedure. So that's gonna be stuff like, I'm gonna hold up a water cup for you, and I need you to sip on the straw to swallow to allow the tube to go down your throat, okay? I need you to raise your hand if you're in any distress. And if you feel like you can't breathe or you can't stop coughing, we're gonna pull the tube out, and then we have to start again because the tube's most likely in your lungs, not your stomach, okay? Does that make sense to everybody? Okay. Okay, what's next?
All right. Inspect client nares and check for patency.
Okay, what does patency mean?
That can go through.
It is clear, right? There's no obstruction. So what does that look like? Okay, I'm just gonna take a quick look in your nares to make sure that there's nothing up there. That means getting a pin light and looking in each nair one at a time to see if there's any obstruction. I think, does it say specifically nares?
Yes.
Okay, I also like to look in the back of the throat through the mouth to see if anything weird is happening back there too, okay? That's just good judgment, but it's not gonna fail you, right? Okay, what's next for our patient?
Adjust bed to comfortable working height and assist client into high Fowler or at least 45-degree angle and place a towel over their chest.
Okay, I've already done most of those things, but I'm gonna place a towel over the chest. Anybody know why we should do this?
In case the acid comes out.
In case they vom.
Oh,
Okay, yep, okay.
close enough.
Mm-hmm.
Measure the length of the tubing by placing the tube tip at the client's nostril and extending it to the tip of the earlobe and then to the xiphoid process.
Okay. Oh, does anybody have a Sharpie on them?
And it says,
A marker? Pin? Nothing? I did not come prepared for my checkoff.
mark the distance with a marker.
Yes. Okay, well that's okay because I've got numbers on this one. Okay, so we're going to measure, okay? Okay, so I'm sorry, I shouldn't really be wearing gloves for this part. I should have put it on when I finished my hand hygiene. Okay, so the thing about the tube is that this tube is going to go inside of your patient, right? So this tube should not be doing stuff like this, right? So you want to make the trip from the packaging to the nose as short and as quick as possible. So don't open it, don't use it until you are really ready to use it, okay? Because I don't want to see it touching a bunch of stuff, okay? It's not sterile because the GI system is not sterile, okay? So this is a clean procedure, which is why I'm wearing clean gloves. I only did hand hygiene, I didn't scrub, and I didn't put on sterile gloves, right? But I, as a patient, don't want to be on the receiving end of a tube that's made a journey all over the place, okay? So clean. Okay, so how do we measure?
From the tip of the nose to the earlobe.
To the earlobe.
Okay. Tip of the nose, I like to go tip, tip, top. You'll see why. So tip of the nose, tip of the ear, top. Okay, I feel the top of the xiphoid process, and I go where?
20 to 30.
20 to 30 centimeters.
To the bottom.
To the base of the xiphoid process, right? It's
That's for
easiest.
intestines.
What'd you say?
They said 20 to 30 centimeters, but that's for when you're going into the intestines.
Right. So we're doing an NG tube insertion, right? Okay, it's a good thing to know, okay? So I'm holding it there, and I'm going to the tip of the xiphoid process, because the top of it is easier to find, okay? You find the top, and then you snake it down with your fingers till you find the base. Can everybody find their own xiphoid process? It might be hard if you're wearing like an underwire bra or anything like that, but it's in there somewhere, okay? If you push it hard enough, it hurts. It kind of hurts too. It's not so comfortable. That's where we sternal rub people, right? Okay, so I think that the patient's tip of the xiphoid process is right there. And you can see I'm holding it pretty taut, right? Okay, so no slack, none of this, okay? Taut connection. Okay, I'm keeping my thumb here. Now I have the benefit of having a tubing that has centimeter markings on it. These are all centimeters, okay? If somebody asks you, how far is your tube in? It's always measured in centimeters. Say it with me. Centimeters. Okay. Somebody gets this wrong every single time. Centimeters, okay? So I don't need to mark it because I can look at the number of centimeters. So 55, 56, 57. 57 centimeters is the amount I need to go into in order to get a NG tube. If I was doing nasointestinal, an I tube, or an NJ, right, jejunum, then it would be 20 to 30 plus, okay? But I'm just doing NG, so it's gonna be right here, 57. Does that make sense to everybody? Okay, I'm ready for my next step.
All right. Prepare tape or fixation device.
Okay, so I'm going to set this on a clean surface, my nice clean towel right here, and I'm going to prepare my tape. So there's a couple of different ways that you'll see people, especially in the clinical practice, do taping. And frankly, there'll also be some fancy devices that people use to tape with. We don't have those. So you're gonna do it the old-fashioned way. And the old-fashioned way is what I like to call pants. Okay, so you're gonna make yourself some pants by tearing tape not all the way through, okay, but just making a little pair of trousers, okay? This piece is going to go across the bridge of your patient's nose, and the open areas are going to wrap around the tube, one going one direction, one going the other direction for a really secure fit, okay? So this is prep work for later on, okay? So I'm putting this off to the side so I can keep it, okay? So that goes across the patient's nose. I like to do a reinforce across the pants. I like to call it the belt, okay? I like to put the belt across the patient's nose on top of the pants so that way the pants don't fall, okay? The last piece of tape is going to be securing it to the patient's gown, okay? That's gonna be a nice big piece of tape, maybe 2 or 3 to be extra secure, okay? So I've prepped my tape.
All right. Apply clean gloves. Already did that. Lubricate the tip of the tube at least 2 to 4 inches with water-soluble lubricant.
Okay, so this lubricant is the only one we can use on the mannequins, so make sure when you're practicing this is what you're reaching for, okay? These are expensive and we don't have very many of them, so in your checkoff you'll need to ask for lubricant, and your instructor will provide it to you, okay? So don't forget, you have to ask. Okay. I'm lubricated.
All right. Give the client a cup of water with straw, and either have the client keeps their neck in a neutral position, or have them flex their head back on a pillow, depending on the policy.
Okay, so what that means is if you have a patient who's doing this number, it's not going to be a very easy journey down, right? So that's what it means, head in a neutral position, okay? Also not very helpful if your patient's like this to begin with, right? Okay, it makes the initial journey in pretty hard. We actually like this position, but not until a little bit later, okay? So that's what we mean by neutral position, okay? For instance, if you're in the clinical environment and you're having trouble with someone who maybe is unable to follow directions or is a child, do you work with those people, okay? Then what I like to do is hold the back of the client's neck, okay? In a real nice, sweet way, okay? But so that they don't do this number, okay? Because as soon as you come at somebody with a tube in your hand, they're gonna be like, okay? And you gotta be like, it's cool, let's just stay right here, okay? Okay? So I keep my hand on the back of their neck, so that way I can say, it's okay, take a deep breath, keep breathing, okay? Keep your head straight. Does that make sense? Okay. Obviously, your mannequins won't be running away from you, okay? So don't stress about that, but I also want you to have applicable knowledge for when you do this on a human, okay? Okay, what's my next step?
Insert tube following nasal passage. Rotate tube to help pass through the nasopharynx.
Okay, fabulous. Okay, so what I'm going to do is I have my patient holding their water in this hand so they can sip at the same time, okay? And you'll have a cup with you on the day when you're in question, okay? And this hand is going to be the one that I tell them, please use this one in order to tell me if you need help, because it's right in front of my face. I can see it, okay? Okay, now I'm going to tell them there's going to be some pressure in your nose and nasal passages, okay? As soon as the pressure passes what you feel like is your mouth area, I want you to start tipping your head forward a little bit, okay? This helps straighten out that area, okay? The other thing is that when people breathe and talk or scream, their epiglottis opens, right? Because we've got the windpipe there, one for breathing, one for food. We want to go down the food pipe. So if someone's talking during this procedure or they're yelling and screaming, their epiglottis opens and it covers the food one. Does that make sense? So if your patient is being very vocal, that could be a problem. Does that make sense to everybody? So what you're going to say is, I encourage you to breathe slowly and, in and out continuously through your nose, and try not to talk unless you feel like we absolutely must stop or I'm missing your signal for some reason, okay? Because that'll keep the epiglottis closed. Make sense? Okay. So now I'm going to start inserting. So I'm going to tell my client you're going to feel a little bit of discomfort. I'm going through for the nair that's closest to me just because that's easy for me. And I'm right-handed, so I'm on the right side of the bed using my right hand, okay? So I'm twisting and I'm pushing, okay? And I'm going to 57 centimeters, right? Twisting, pushing. And I'm gonna say to my client, do you feel like it's past your mouth? Yeah? Okay, I'm gonna tip your head forward just a little bit. Of course, this mannequin's head doesn't move. So I'm gonna keep going. I'm at 25. Keep breathing, you're doing a great job. My client is not in distress. What would distress look like if they weren't telling me something?
Lots of
Like grimacing.
color.
Okay, color, what color would they be?
Blue,
Pale, blue, okay, not breathing, right? Lots of coughing, lots of gagging, right? When you're in the clinical environment, you'll most likely actually put an SpO2 probe on your patient during this procedure so you can see if their oxygen saturation drops. Does that make sense? Okay, so I'm at 40. I need to keep going. Also, you can never let go of your NG tube because some people like to get a little bit interesting and rip it out. So don't do that. Eyes on the prize. This is hard to pass. Okay, I'm at 45. Like 10 more centimeters to go. And yes, it can become difficult. I believe in you. Okay, I don't see it coiling in the mouth. I'm almost there. 55 centimeters, 57 centimeters. Okay, this is what I wanted. You see how I'm holding on to it this whole time? Not letting go. Okay, time for some trousers. my pants. I'm wrapping my pants around my tube. One goes one direction, one goes the other direction. Okay? Still not letting go of my tube. I'm putting my belt on. Okay? Belt should only be just a little bit bigger than your trousers, right? That's how belts work. Okay? And now I'm ready for the piece of tape that's going to secure it to the gown. It is vital that when you secure it to the gown, this thing right here is facing up. Okay? If this faces down, it may spill contents on your patient. In addition to that, because I'm nice and I don't like it when my patients get covered in their own gastric contents, I put this right here just in case. Okay? So this is how it's gonna look right when you finish. Okay, what's my next step?
Provide reassurance to the client if gagging occurs, tube reaches pharynx, ensure tube is not coiled in pharynx.
And how do you ensure that it's not?
Check in the mouth.
Looking in the mouth. Yep, okay.
Once the pharynx is reached, have the client flex their chin to their chest and encourage client to sip through a straw while advancing the tube downward direction when the client swallows, pausing when the client breathes.
Okay, so that's an important step. Why would we want them to be sipping water while we do this? Okay, it will help lubricate it, and there's a second
Close
reason.
the epiglottis.
It will close the epiglottis, so that way we don't go into the lungs. Okay, so it's a twofold reason. Helps with that. Okay, now what?
Stop the procedure if client becomes cyanotic, is unable to speak or hum, or has continuous coughing or gagging, or if unable to advance the tube after rotating it.
Okay, we did all that.
Continue advancing tube until measured mark is reached. Secure tubing temporarily with tape. Done. Determine tube placement by checking aspirate pH, visualizing aspirated contents for color and consistency. Use a CO2 detector and obtain radiographic confirmation.
That's a big step. Okay, there's a lot happening there, so let's talk about it. Okay, so how do I get gastric contents?
Pull them out.
Pull them out. Pull them out where? How?
Right at the top of the tube. and-
Okay, so I'm going to take this little thing off for just a minute. This is like just an adapter, okay? But I want to keep track of that. It is an important piece, okay? And I'm just going to withdraw some gastric contents, okay? I don't like to lose things, so I'm going to put him back right away. Thank you, sir. Okay, and now that I have some gastric contents, I'm going to look at it. What should it look like?
Kind of green, yellow.
Green, grassy stuff for the most part, right? Okay, this will typically tell us if we're in the GI system appropriately, okay? The other thing we can do is test for pH, right? So what should your pH be? Okay, it should be acidic, right? So around 5 or less, okay? And then what's the absolute surefire way to make sure you're in the right spot?
X-ray.
X-ray. So you're going to verbalize, now that I've seen this and my pH is this, I'm going to ask the doctor to put in an order for an X-ray, okay? That's the only absolutely conclusive way to say you are in the stomach, okay? Because it literally shows us where you are. Because if someone's like really full of bile and all this juice, right? If you're short of the stomach, you could still be getting this. Does that make sense? And it could still be acidic, but that also means it's burning up your client's esophagus. Does that make sense? Okay, so we want it to be all the way in the stomach without going past. Okay, now what?
Mark the tube at the client's nostril.
Okay, so with my pen, I'm going to mark it right where I put it in, which is 57, and that's also where I would document it, okay? So you'll use your Sharpie initially to mark where you're going to put it, and you're going to use your Sharpie again to mark exactly where you left it at the nose. When you put something in at the nose, you see these black markings? The black markings should just be visible from the tip of the nair, okay? So it should be all the way in from that centimeter point with just that black line just showing, okay? Some of you do not have lines, and that is okay. That's why you mark your tube, okay?
Apply skin barrier to the nose and secure tube in place with tape or fixation device.
So we already did that. So we're not going to do any temporary fixation because that's just not going to hold, okay? So you're going to start with your trousers and your belt and then this, okay? That's it.
Secure tubing to the client's gown. If a double lumen is used, ensure vent is above stomach level.
This is your vent. This is a double lumen. It must be above the stomach, okay? No hanging down low, always facing upright.
Remove gloves and perform hand hygiene.
Cool.
Apply clean gloves and provide oral hygiene.
Okay, what does oral hygiene look like to you?
Open up, scrub.
Toothbrush, toothpaste, right? Clean, clean, clean. Why do you think oral hygiene is important?
Stomach acid could have gotten in there possibly.
Stomach acid from the journey up or down, from people vomiting a lot, and also the fact that maybe this person's not eating anymore and they're not drinking anymore potentially because they have this new tube in. It's very important that we clean people's mouths when they're not eating or drinking anything, okay? Water helps clear out bacteria a lot. Okay.
Discard supplies, remove gloves, and perform hand hygiene.
Okay, fabulous. I did my cleaning. That's done for me. And I'm gonna take this off my client. Okay, what else is there?
Ensure that the client is in a safe position prior to leaving the room and has the call light within reach.
Okay, so safe position means what?
All the way down.
All the way down towards the ground. I'm gonna keep this client sitting upright with this tube in, so they're gonna be still at least 30-degree angle, but they do need to be all the way down. Okay.
And then document procedure and client's tolerance.
Okay, so what does tolerated well mean to you?
Slight grimacing, didn't
Did not throw
threaten.
up, no vomiting, yep, no cyanotic episodes, breathing, remained calm, right? Okay. What else might you document about this? What would someone want to know?
How far you put it in.
Especially how far you put it in, right? So the big problem that I see in clinical practice is when you have a patient with an NG tube and the first thing you look at isn't the marking, okay? The marking should be the same as the day it was put in, and it should be the same as what's charted in the chart. If it's off by a centimeter, we may have a problem, okay? If it is off, let's say by 10 centimeters, what do you think you want to do about that?
Report it to the doctor.
Okay, what do you think they're gonna order?
An X-ray.
A new x-ray. Before we do anything else, let's take an x-ray, because stomachs are big, right? Maybe it's still in the right spot, or maybe we just need to advance a little bit more, okay? So don't get crazy and start pulling tubes out because they're not in the right spot, right? Okay? X-ray is the definitive way to know if it's in the right spot, okay? Does that make sense? Okay, we have a beautiful tube in place. The only other thing that we might do, okay, in clinical practice, so you know, is hook up some suction, okay? And that's what that looks like. Easy peasy, nothing to it, okay? All right, let's take this tube out.
All right, verify the medical prescription for removal of the nasogastric tube.
Okay, got one.
Provide privacy as needed.
Okay, shutting the blinds.
Introduce yourself to client.
Hello there, again.
Perform hand hygiene and put on appropriate PPE if indicated.
Okay, what is indicated? Gloves. Yep, okay,
Verify client identification and check for allergies.
got it.
Provide client education.
Okay. Anybody know the client education?
We're gonna be removing it too.
What do you want to do about it?
They tell them, oh yeah, hold their breath.
Take a deep breath and hold, right?
It's gonna be uncomfortable.
Most likely. What's next?
Adjust bed to comfortable working height and
Yep.
raise the head of the bed to 30 to 45 degrees.
Okay, we like people nice and up high for this. Okay, now what?
Place towel across or a pad across the chest. Offer tissues and emesis basin.
Okay, emesis basin, towel across the chest. Got it?
Put on clean gloves.
Okay. Done.
Ensure any wall suction is disconnected from the nasogastric tube.
Disconnected. Got it?
Detach the tube from the gown.
Got it?
Remove the taper holder from the top of the nose.
Okay. Keep going.
Flush the tube with 10 milliliters of water or 0.9 sodium chloride irrigation solution, or instill 30 to 50 milliliters of air through the tube.
Okay. My preference is water. Does anybody know why I'd prefer that over air?
It really flushes it out.
It really gets it, right? Okay, what else?
Kind of fills
Can give you
it.
gas.
Yes, I hate burping. Okay? It's uncomfortable. People don't like it, right? If I push a bunch of air into my client, what are they going to start doing? Burping. And I don't like it. Okay? Water. That's my
Perfect.
pronoun.
I think I throw up when it comes out too.
Okay, so I'm flushing with some water, nice and slow, cleaning the tube out. Got it?
All right, clamp or kink the tube between the index finger and thumb.
As so.
Ask the client to take a deep breath and hold the breath.
Okay, take a deep breath and hold it for me, okay?
Smoothly and steadily pull the tube to remove with dominant hand and collect the tube in a towel or disposable pad with the non-dominant hand.
Okay, ready? We're gonna pull it out on 3. 1, 2, 3.
Check the tip for intactness.
Okay, I like to make sure they're clean. And I like to check the tip for intactness away from my patient a little bit so they don't have to look at the ooey gooey. Okay, so I'm taking a look. I see the tip of my tube is intact. Okay, and why do we do that? Make sure nothing's in there. We don't like stuff left behind in people, right? Okay.
Measure and record the amount of output in the container by the markings on the container.
That would be in here, right? Okay.
Dispose of the tube and suction equipment per facility policy. Remove gloves and apply clean gloves. Clean nares and provide oral hygiene.
Nares, oral hygiene.
Ensure that the client is in a safe position prior to leaving the room and has the call light within reach.
Okay. Any questions about that?
No.
Easy stuff, right?